There are literally hundreds of trials underway around different parts of the world to test possible COVID-19 treatments and vaccines. If you're on the receiving end of that treatment and medication, you have to thank people willing to take part in clinical trials testing if they're safe and effective. So what measures are in place to ensure that those who put their hands up are actually safe? Tian Johnson of the Vaccine Advocacy Resource Group joins us now to discuss this a bit further. I suppose, Tian, there's a great risk that any individual who signs up for a clinical trial is putting themselves up for, but there must be measures in place to ensure that those pharmaceuticals or even researchers who are responsible don't completely just go AWOL.
Absolutely. I mean, I think, Cathy, research participants are one of the most under-celebrated groups ever. These are people who put their health, their well-being, they invest time and sacrifice to make sure that even the best science in the world that would come to nothing without them really goes ahead. We've seen this from as far back as the Nuremberg trials, you know, when medical research was really brought into disrepute by the Nazi doctors. But in South Africa specifically, you see that South Africa has established protections for participants of research that have been in place for decades, even before these protections were required by law.
How standardized are these protections? So what is it that you're told about in the contract that you have to sign as you enter a vaccine trial versus what the law gives you, what you're entitled to as somebody in that position?
Yeah, so I think the South African Medical Research Council has set out guidelines on how research should be conducted responsibly. These guidelines are continuously revised, and it really sets out how trials and research should engage with and recruit and treat participants. So we've seen that we're worlds apart from how research used to be conducted. We must always remember that research, whether vaccine or treatment research, has never been historically conducted with the best interests of the community at heart. And so we've seen the sector really change. And today, each trial is really governed by what we call a protocol. That protocol will allow a potential participant to sit down in front of a member of the trial team and let that member of the team take them through this protocol. The protocol really outlines what the trial is about, what the participant can expect, what protections are in place for that participant. If the trial is collecting samples or biological specimens, it's very clear in terms of what will be done with those and how those will be used, et cetera, et cetera. So I think the real focus is on how research can really protect participants. And with the advent of COVID and the flurry of research that is taking place, whether vaccines or treatments, advocates really have to be informed and aware of what this research entails. We've already seen COVID-19 trials in South Africa that are falling foul of community engagement. These are trials that are not engaging communities and trials that are not putting participants first. And so we really have to be aware and informed and work with our communities to ensure they are equally aware and informed around how ethical and accountable research must happen.
Sure, and ethics is always a big issue when you're talking about trials. Tian Johnson is with the Vaccine Advocacy Resource Group. Thanks for your time on the Pulse today. Well, we continue here, as we saw in that report earlier on the Pulse. It's no secret Zimbabwe's economy has been struggling for some time now. The COVID-19 pandemic has dashed any hopes of reviving things. Joseph Busha of JM Busha Investments joins me now for some insight into how Zimbabwe could possibly pull through this. It's going to be a difficult journey for the country, Busha, undoubtedly. But let's speak about some of the findings that have come out of this recent United Nations Development Programme study, which highlights exactly how difficult the economic situation is, but also the fragile health sector that Zimbabwe entered this pandemic with and now could completely collapse if it's not brought under control.
No, certainly. Good evening to the viewers as well. I mean, Zimbabwe has been in a financial crisis and social crisis for the past 2 decades, starting in 2000. And you have seen certainly that everything has deteriorated. The infrastructure has deteriorated. So when COVID entered into Zimbabwe, well wishers and people had to rush to try and improve part of the infrastructure in some of the hospitals in Zimbabwe. What was worse really is that the elite, which is the extractive elite in Zimbabwe, they've been traveling abroad for medical attention. They've been coming here to South Africa. They've been going to Russia, China, and Malaysia. You are aware that the late President Robert Mugabe never used to be treated in Zimbabwe. So certainly the health system in Zimbabwe, is as it sneeze. There are no medicines, and people sleep on benches. And this really has just brought to the fore that you cannot get the elite that has got capacity and access to go and get treatment outside, not to neglect the local infrastructure. So it is a sad case for Zimbabwe. They don't have the money, and I think China has been helping quite a lot. We saw that there were 10 doctors or specialists that arrived there 3 weeks ago to be able to try and see how to arrest the situation down there.
Sure. We recently interviewed an MDC representative who also spoke to us about the clampdown that has been happening in the country, especially on informal traders who we know depend on this income. And the police are saying that they're enforcing the lockdown measures. But we know the impact it's had in South Africa, but those in Zimbabwe are seemingly even worse off because they're simply being rounded up left, right, and center.
Well, this is not the first time. Remember, we had Murambachina in 2008, where they demolished not only just their sources of livelihood, but also their homes in the name of trying to clean the city. So they're now using this COVID as well to do exactly the same. Unemployment rate in Zimbabwe is sitting at about 90%, where either you are a vendor or you are a taxi driver. And this is how people basically earn their living. So you are living in a dollar economy where basically you have to survive on being able to sell either second-hand clothes or goods or vendor stuff. And most of them, they get their stuff from here in South Africa. Unfortunately, the border is closed. So when you then restrict people that they can't earn a livelihood, I think that becomes quite problematic. And hence you get, obviously, the World Health Organization and other people are really coming in to say the situation in Zimbabwe is dire. But it's not just dire. It's really fatal, because we really don't know how many people are not dying from COVID, but possibly dying from hunger.
Is the government in Zimbabwe transparent enough about the extent of the crisis that they're facing currently, especially even if we look at the health sector? Doctors have had to take pay cuts upon pay cuts to the point where some simply just don't work anymore because they don't have the tools they need to conduct their trade safely.
Certainly, I think, as I said to you, this is not a new issue. Remember last year, the junior doctors and doctors that were on strike, and the nurses were on strike, then they got fired by the deputy president, and then they come back. So it has been a back and forth in Zimbabwe. They don't have the protective clothing. I guess it's coming now. So it has been quite a big issue in Zimbabwe in terms of, how do they do their work, not just, safely, but also ethically, given the fact that, if you feel that you might be exposed, but you don't have protective clothing or the tools to be able to conduct your work safely, what do you do? So it's a real leadership issue, I think, in Zimbabwe, which has been compounding, and not just over the last, 10 years or so, but as I said to you, the last 2 decades, Zimbabwe has been very difficult.
So where do the answers lie then? This change of power was supposed to bring with it some glimmer of hope, controversial as it may have been. But by the sounds of it, even that has been completely put out now.
Well, there was no change really in Zimbabwe, so the system remains the same. So you have got a very extractive political and business institutions in Zimbabwe that really just thrive on the masses of Zimbabwe, on the poor of Zimbabwe. So there was no change. So ZANU-PF still remains in government. Basically, what they changed is just the presidents being removed and replaced by the deputy president. which you must understand, they have worked together for the past 54 years as his aide. So there's no new changes, there's no new learnings. That's why things have got worse, because until you earn the trust of citizens and the global community, you really can't do anything. We live in a very globalized environment. And you've seen that the situation in Zimbabwe have made things worse across the region. We saw that, in Botswana. They repatriated, I think, about 500 Zimbabweans, and most of those now are testing positive for COVID. And that was also rushed, where they just put in a makeshift places around the border areas. So there's no change in leadership. It's the same system that has been there for the past 40 years.
Sure.